Doctors never really were able to tell me what was wrong with me. I've had numerous tests done on me to figure out why I have this pain and discomfort in my upper right abdomen. Upper right abdomen. Okay. I had a HIDA scan, is that what that's called? CAT scan of my upper right abdomen, stomach, emptying test, endoscopy, colonoscopy, ultrasound of my gallbladder twice, and blood tests. Through all the testing, this is what was found. Enlarged spleen. All right, let's stop right there before we go on. Enlarged spleen. Now, of course, that's over here, but enlarged spleen. What would enlarge something? We call that hypertrophy. Enlargement. Hypertrophy, enlargement. Now, what would enlarge things? Let's see. If you're nothing but a cells and two fluids, it could be the blood. You know, you got a lot more blood in this. No, that wouldn't be it, would it? Where are we at, guys? We're at the lymph again, and she's not moving her lymph system. Obviously, this is why they can't see it. This is common. You have the iris, you can see her lymph system, but I can tell you, her lymph system's backed up. In the first clue, enlarged spleen. What enlarges? What causes congestive heart failure? Pulmonary edema. Enlarged spleen. Lymph. Lymph, lymph, lymph. But this is acids. So in time, you'll break down your spleen. But the same thing's happening in your gallbladder and liver, or in your bowel wall. You can take your choice. You got your colon, you've got your liver, and you got your gallbladder. And then they removed your, well, you just want to remove their gallbladder because let's see here. Enlarged spleen, sluggish gallbladder, only 40% injection fraction, elevated bilirubin, and elevated cholesterol. Elevated cholesterol, let me see. What did we discover the cholesterol was? Yes, the body's main antacid. Well, wait a minute. We got a large spleen, high bilirubin, we got high cholesterol. What do we got? We got acidosis, right? We got it in the liver. That shows it right there. We have it in the spleen. That shows it right there. So we got a lymph not moving well, but wait, here's more. All right, that sounds like a commercial. I have swollen lymph nodes. Interesting, huh? And the doctors couldn't figure this one out. Oh, that's too bad. Also, I had the gallbladder removed, and it didn't fix my problem. Yeah, I bet it didn't. My sister had a lot of pain and discomfort in this area, and they thought it was the gallbladder and removed the gallbladder, and she put up with for about 10, at least 20 years. So she came down here one day. She's from Indiana. She came down here one day, and I watched her eat, and she ordered a steak, and she told the waiter, said, well, just throw it on the skillet and or on the grill, and just throw it on the grill, let it set for a little bit, and then throw it on the other side and let it walk out to me. You know, that makes me throw up to think of raw meat. I just can't handle the smell of the meat section in grocery stores, let alone look at dead tissue with blood and everything. That just makes me throw up. I knew immediately she had tapes, and boy, we put her on the herbs, and she got out 3 large tapeworms. One head was so big, I figured it was at least at the Smithsonian, at least 25, 30 footer. But she'd had them for, well, the pain had been going on for probably 30 years. So this is the sort of thing. Of course, you always deworm yourselves. Always deworm yourselves. Parasite G and M. Put yourself on a good deworming program. I don't care whose it is, and deworm yourself. Especially wormwood and the like. But I can tell you that your lymph system, this is an easy understanding, honey. Easy, easy, easy. Who is this? This is Siobhan. So, sweetheart, this is easy to understand. You're just going to the wrong docs. These guys are, some of them just, they're not educated to the level that you would expect that. So anyway, this is your lymph system. Obviously, your lymph nodes are swollen. It's telling you right here what your problem is. That's acidosis. That's going to breed pain. But if you constantly have pain, you're breaking down tissue here. So you got to be careful. You got to move your lymphs. I do a liver formula, no question. I'd probably do a spleen formula. Someone asked me about blood work. You know, you can always have your blood work sent to us, and I can look at it a little bit here and go over it with you if you don't mind me talking about it in front of people. Another thing you can do is go to an ophthalmologist, and I don't want a landslide of these, but you could go to an ophthalmologist and get a picture of your iris. And you don't have to have your pupils dilated. I don't want a picture of the pupil or retina. I just want a picture of the colored portion of your eye, and I can see everything there for you. However, this is an easy case to understand, honey. Your lymph system's backed up and it's chewing on you, but it's all in this area, and you probably have a little pancreatic swelling too, a little pancreatitis, even though they might not see it. You can't see acid chewing on tissue in a CAT scan. Oh, when that liver gets hard as a rock, you will. Oh, unbelievable. So don't worry about the phone consult affording stuff like that. Get on this diet. Lots of grapes. If you can afford any herbs whatsoever, don't put your money on talking to me. That's why I'm doing these videos. Put your money toward the herbs that'll help you. Whatever you can afford. Focus on your kidneys. Focus on your adrenals and your lymph. Those three, number one. You're also, I'm going to tell you, have to focus on your colon too, honey. You got to get into that colon. If you can afford it, add a liver formula, and then go down the road. The spleen will come unswell and everything else when you move your lymph. But then let's see what your platelets and things are. You might have to go after your spleen a little bit. Depends how long this has been going on in you. See, this is the problem. We'll just watch this. Oh, we can't find... I have people come in here all the time where the medical doctors say, oh, this is just in your head. Oh, yeah, I'm sure some of you have found that.